Hi, this is Yazan Daaboul, live from the American Heart Association in Chicago. Dr. Huffman, thank you so much for joining us.
Thanks for having me.
Dr. Huffman, you just presented the results of the QUARTET USA trial. Tell us a little bit more about QUARTET, quadruple antihypertensive therapy. Tell us a little bit more about the unmet need. We've seen a lot of low-dose triple therapy before. What's the advantage, or what's the hypothesis for quadruple therapy?
Thanks, Yaz. I mean, think about this. Most patients around the world do not have their hypertension controlled, no matter where they live. We need a new paradigm. So rather than initiating upfront therapy with one drug, titrating the dose up, and then adding a second one, going up, and getting the side effects, the idea with QUARTET USA is to initiate patients on a combination of 4 drugs, but at ultra low doses, at quarter doses, so like amlodipine 1.25, doses that we would normally prescribe. But by bringing all of those medicines together, what we do is we improve the blood pressure lowering effect while minimizing the side effects.
What were the combination?
Well, what would you want in your combination? You want the typical classes, right?
We'll need a calcium channel blocker, a thiazide.
Right, you got it.
Okay, what else? Like an ACE inhibitor, maybe? Or ARB, yeah.
Better tolerated, right?
Okay.
And then your fourth was bisoprolol in
Okay.
this case. So we manufactured this combination product, and then we compared it against standard dose ARB monotherapy, because ARBs are the best tolerated of our monotherapies that we use. And so the hypothesis was really treating with 4-drug quarter dose combination therapy versus standard dose monotherapy. Would that reduce systolic blood pressure at 12 weeks? And so we randomized 62 participants from a federally qualified health center network here in Chicago, and demonstrated a 4.9 millimeter mercury lower systolic blood pressure and a 4.8 millimeter mercury lower diastolic blood pressure at 12 weeks. Only the diastolic pressure results were statistically significant, but the direction and magnitude of effect was similar to what was observed in a larger study called QUARTET, conducted in Australia among largely white and Asian patients, whereas in our study, the majority were either Hispanic or Black.
In terms of comorbidities, was there any signal for benefit in people with prior, diabetes, MI?
So this was a primary prevention population. We didn't have enough statistical power to look at differences across subgroups, but I think by having consistency across these different populations, instead of thinking about only that multi-drug combination therapy, like 3-drug combination, we think of it for our patients with resistant hypertension. It's really trying to move this upstream in our management of patients with high blood pressure, because again, the current approach isn't cutting it. We have to be thinking differently.
Yeah. Was there any actual side effects from the 4 quadruple therapy?
Right. So that's what the concern would be. So the rate of all adverse events was higher in the intervention group, but the rate of probable or greater was similar between groups. And then actually the discontinuation rates were higher in the control, the ARB group, rather than the combination group. So again, small numbers. In the QUARTET trial, which had an extension over 12 months, there was about a 4.4% rate of discontinuation in the intervention group compared to 2.4% in the control. So, I mean, there's a little bit higher AE rate, but given the large benefit that was observed, seems to be worth a trade-off that most of us as doctors would take, and many of our patients would as well.
What's next after, QUARTET USA?
Right. So we need to think about how do we get larger studies in more populations, and ultimately partnering with pharmaceutical companies that are interested in this type of approach to manufacturing medicine. So, we have 3-drug combinations on the market, so 4-drug would be a logical extension.
Yeah. Dr. Huffman, thank you so much for joining us, and congratulations on the results of the QUARTET USA trial. And thank you all for joining us live from AHA 2022.